Hello, everyone. I am Alexandra Diamoyawoyi, happy to share the first part of this series answering the question, what is the current state of play in Africa's healthcare sector with a specific focus on Nigeria? Today's guest is Vivian Nwakah, the co-founder and CEO of MedSaf, an enterprise pharma supply chain company based in Lagos. This is UNAJUA, where we offer minimal actionable responses to important questions in about 15 minutes or less. But before we get to that, let's pay some bills.
Social Stack co-founder and CEO, Andrew Berkowitz. What are you doing in our promo segment?
Well, Ndile, I'm here to announce proof of play on Cello. Listeners can finally earn the ATRU token just by listening to the podcast.
You don't say.
I do say. All listeners have to do is sign up for their social token wallet at wallet.socialstack.co. And at the end of every episode, they can fill out the Google form in the show notes to answer the question that the ATRU team asks and earn ATRU social tokens just for listening in.
You heard the man, folks. Sign up for your Social Stack wallet at wallet.socialstack.co to access your CeLO address right now. Then all you need to do is pop your name, email address, and CeLO address into the Google form linked in the show notes, along with the answer to this question. Which African country attracted the most tech venture capital in 2020? The answer at the end of this episode, so stay listening.
Like most life changes, MedSaf was born out of personal stories. The passing of Vivian's friend who was killed by fake drugs. Vivian and her team went on to launch a pharmaceutical tech company that brings a database that creates solutions to process drug delivery in Nigeria. And with the help of several investors such as SeedStars, Bill and Melinda Gates Foundation, and the lead investor, Google Launchpad Accelerator, MedSaf has raised around $1.7 million in 6 rounds since their last round in 2019. Now, here's Vivian Nwakah factoring in on 3 questions. How big is Nigeria's healthcare sector? What does the scene look like at grassroots level? And how are tech startups like MedSaf attempting to usher in a new paradigm in Nigeria's pharmaceutical industry?
In MedSaf, we are a pharmaceutical technology company, and we're distributing pharmaceutical products, medications and consumables to hospitals and pharmacies. And that industry on paper is projected to be about $2 billion a year. In Nigeria, I believe it's $14 billion across Africa. That's the projections on a yearly basis. But one definitely big learning lesson that I found starting a business in Nigeria is that a lot of the ways that people kind of quantify what's actually happening on the ground is not really transparent. So that information really isn't so easy to be aggregated. So a lot of things and numbers, can potentially be in the dark. And specifically in the pharmaceutical industry, where you have, majority of medications and consumables coming in from, I think it's over 95% of everything is imported. Local manufacturing isn't, at its peak yet. So you've got such a huge reliance on importation, definitely medications or consumables coming into the country through the borders or through the ports that might not necessarily be recognized. That's definitely an issue. And then, of course, medications that are not registered in the formal, regulatory system also, won't necessarily get counted. The reality is that, how big is the healthcare sector? I wouldn't necessarily say that the numbers are so trustworthy in total. I would definitely say that there's what they said when we started the company was that the pharmaceutical industry was projected to be about 10 times, the formal industry. So I think that's a key piece of trying to understand healthcare in Africa or healthcare in Nigeria is that a lot of work needs to be done on bringing dark or gray parts of the healthcare system into the light. And I believe that companies like MedSaf, which are pharmaceutical technology companies, we're creating that database and the processes that make it easy for products to move through our system and be registered and counted and tracked, we're, the companies that are bringing, this healthcare industry into the light. Today, I just came back from a doctor's conference, and the reality is that it's extremely underfunded in general, and the private sector really drives the healthcare in a Nigerian context. So you have doctors who are struggling because they went to school to be doctors, they want to give good patient care, but they're also dealing with all of the challenges of building a business, right? Because they've now got have to take on the challenge of building a hospital and running it professionally through their own funding sources, to be able to be successful. And so you've got an industry that's just drastically underfunded and with minimal support from a government perspective. There are programs, I think, that have been successful, like HIV, for example. Those medications are free. You can go to a government hospital and get any of those medications to manage your care, but definitely funding, the percentage of the budget that actually goes to healthcare is very, very low. And then of course you've got, I think, in health insurance, from the last time I checked, was under 5% of the population has health insurance, and most of the population that does have health insurance would be working for large corporations, or they would be working for the government. And so that's a very tiny part, or piece of the total population. And so majority of your healthcare costs are going to be out of pocket. And so if you're wealthy, I think before COVID-19, if you needed healthcare, you flew out of the country to go and get it, right? Because, you even see, I think our president right now is literally on a healthcare trip in London. So you see wealthy Nigerians can fly and go elsewhere, but, the average person has to pool money and resources from family and networks to really to kind of take care of any large problems. And of course, with COVID-19, travel is just not as easy as an option as it was before. Whether it's the vaccine passports or requirements, or even just the giving out of visas, which is already hard enough for the average Nigerian, right? But now after COVID-19, the excuse is, oh, it's COVID-19, right? So it's even harder to leave the country. And so you now, I would say, see people really kind of starting to look around and say, okay, well, what are the healthcare options here? And there is definitely investment that is coming and improving the industry overall, but it's a little for a massive problem. So healthcare in a Nigerian context is bleak. We are at the forefront of proving to the masses that you can use technology to, our motto is that MedZaf, our platform, is increasing access. So making it easier for pharmaceutical companies to know that their products can move through the system. So introducing the introduction of new products, or products that are typically not available in a Nigerian context, or maybe were not registered properly. We're kind of creating this avenue, this transparent supply chain for that improvement on access of medications. We are helping to reduce the cost of medications, because by having this really great service that hospitals and pharmacies anywhere in the country can sign up and actually can purchase medications or consumables from our platform, and we can help them manage their medication needs. We now have, some crucial information around where these medications are located across the country, and also where they're needed. And that aggregation power allows you to drop prices and be transparent about your prices, which then allows hospitals to purchase reduce costs on medication purchases, not only from the price point of the medication itself, but also all the investment that goes in their individual operation to procuring those medications, going out to the market, or, going out to pick up medications throughout the day, or, not being able to kind of really vet, their prices against others. And of course, the quality of the medications start to increase when you're able to have better pricing. So if maybe I was going to pick a tier 3 medication, maybe an unbranded generic, maybe because I see better pricing with MedSaf, I might be able to get a branded generic or maybe even a tier 1 medication that's gone through that R&D process and has been formulated in a really good way for whatever the ailment might be. A better medication at a better cost, or you can actually we actually have about 7 various layers of quality control, checks and balances that go through our platform, or that medications go through when they would go through our platform. So we also, just in the process of moving medications from point A to point B, are improving the quality of medications that end up getting to our end user. So this is just an example of how using technology and really data analytics, which a lot of people don't talk enough about, but that's really how we're kind of able to handle the orders that go through our system. By doing that, now we're able to kind of drop prices and make medication more accessible to the average hospital or pharmacy, which of course means that the patient, now has better options as far as medications. We recently just started shipping out across the country, so we're starting to get orders from hospitals mostly in clinics that are in, more rural areas of the country. And so, they're getting access to medications that typically would have been a little bit harder for them to get access to. And so this is how you can use technology to really democratize, medication distribution, which in turn improves the overall healthcare outcomes for a country like Nigeria, creating this kind of network effect. Because, guess what? When we first started, a lot of our hospitals were completely on paper. Nothing was digital. And then, we started seeing them starting to adapt to Excel, which is great. And then we started seeing people talking about, okay, I'm putting EMR systems in place and things like that. And so now it's not even just their medications, because remember, they have to get their medications every day. So they're seeing technology improve the way they're getting their medications, but then they're realizing the benefit of taking that same concept to other parts of the business, like managing patients or, working with insurance companies, etc. That makes it even easier for them to do their jobs too. So overall, the digitization of healthcare, whether it's telemedicine or a company like MedSaf or an EMR company, is just going to make it easier and more accessible for the average African to get better quality healthcare.
Hope you found that useful. There's more coming to you next week. Before we go, here's Andile with a sweet to this week's question.
And here we are with the answer to today's question. Which African country attracted the most tech venture capital in 2020? Well, the answer is, it depends. Now, according to Partech Africa, Nigeria came out tops at 307 million. The Disrupt Africa report reckons Kenya edged out Nigeria, coming in at 191.4 million. And the Brighter Bridges report doesn't even list Nigeria in their top 5 because their report is based on where startups are, in fact, domiciled. So by that standard, the US comes out tops. But since the US is not an African country, South Africa wins out at 119.7 million, according to Brighter Bridges. Now, any of those 3 answers will do, folks. Again, all you need to do is pop your name, email address, and CELO address into the Google form linked in the show notes, along with any of the 3 correct answers to this question. And we'll be sending ATRU token your way. Thanks for listening.
That's it for now. Thanks for listening. Do take care.